We're here in Liverpool. We're hosting a visit by NHS England's top team to the city. They're actually in town for the biggest show of the year, which is NHS Confed Expo, taking place just behind me at the ACC. So we thought we'd take the opportunity to show them some of the great work that we're doing here in the city. We're going to take them to 3 venues across the day today, starting off with Clatterbridge Cancer Centre, where we're going to be demonstrating our work around system partnerships.
Well, it's fantastic to see the work they're doing at the Clatterbridge, particularly around some of the really cutting-edge science. So we saw presentations from clinicians about the work that they're doing to support the early-stage research and the development for cancer vaccines. So if these work, these will be really tailored treatments for patients that can help boost the efficacy of the treatments that we've got, at the same time reduce the toxicity that patients experience. So a much better outcome for patients and a far lower toxicity for patients. And I think the important thing for that is that it's really closely linked to the UK Life Sciences vision. So immuno-oncology, so these kind of vaccines that can help cancer care for patients, was identified as a really important area, and it really ties in with reducing healthcare inequalities, because that's particularly important for patients who are suffering with cancer.
After that, we're travelling to Liverpool Heart and Chest Hospital, where we'll focus on some of the clinical work that we've done, primarily cardiovascular and respiratory disease.
So we heard a lot about HeartFlow, which is a technology that produces an image of the heart, provides diagnostic information to the clinicians. It was particularly heartening to see some of the translation of national policies, so things like the MedTech funding mandate and the innovation and technology payment, and actually the impact that those national policies are having on the ground. It's fantastic to see the locally led work that the clinicians are leading, and also the support that the Academic Health Science Network had provided in order to get that programme off the ground. And it was really important to note that actually that's been a fantastically successful spread programme. So we've seen one hospital initially using that technology. It spread to 50 through the innovation and technology payment, and then scaled up to 90 with the MedTech funding mandate. So really, really good to see that actually we can spread innovation really efficiently in the NHS.
And then we're finishing the day over at Alder Hey, where we'll be looking at the support we offer to businesses and innovators, helping them get their products into the NHS.
Well, the HSNs have got a really, really valuable role. I mean, we're here in an innovation lab, and if you're an innovator, they're a fantastic resource to go to. So I would urge anybody who's got an idea that they want to develop, go and talk to your local AHSN. They can provide networking advice about organisations to talk to where you can get it tested or developed. There can be commercial advice, because often the people developing the ideas don't perhaps have some of the business background in order to do that, or vice versa. There might be people who've got a business background who want to understand how the NHS works. So they're a fantastic convening organisation for bringing together all of those different skills and links into those organisations.
I think the key thing I'm going to take away from today is just the collaboration and the way that the trusts and the way that the different organisations across Liverpool actually are all working together to deliver a first-class NHS service.